Hello, everyone, and welcome back to Rarely Typical, a podcast where I am talking about living with a chronic illness, finding hope, and living a life that is rarely typical. Today, I have Dr. Shaila Siraj with me, and we are going to be talking about something I think is very important for both my patient audience and my medical professional audience to hear. Today, we're going to be talking about what it looks like to have compassionate healthcare and what that means for both your practice and how you as a patient can collaborate with your doctors. And I think it's going to be really insightful and really cool. So, hello, welcome.
Hi, thank you so much for having me on. I'm very excited to have this conversation today.
Today, we're going to chat about what real patient healthcare looks like in the actual medical space. And then we're going to talk about why it's critical and important for doctors to be compassionate in their practice. I want to chat a little bit about my story, but I really just want Dr. Siraj to talk about all of the things that she does and how you, if you are a medical professional, if you are new to the medical profession, how these challenges can be faced and how you can be compassionate when you're in clinic.
I'll just introduce myself a little bit. So my name is Shaila Siraj. I'm a double board certified general pediatrician and certified in pediatric hospital medicine, which means that I see patients all the way from birth to 21 years of age in the inpatient setting. If for any reason a child needs care in the hospital, likely that I'll have some sort of interface with that patient. I have been in practice now 11 years, and that kind of makes me a mid-career now. I'm no longer early career, and I definitely feel that. And one of my big passions now, as we're thinking about how our careers can shift at this time, has been exactly this topic. So thank you so much for bringing me on about compassion. How do we cultivate it? How do we keep that flame burning among all of the changing, I think, aspects of healthcare, which in my, 11 years, I've definitely seen it shift to something that some days I feel like is unrecognizable, kind of counter to so many of the reasons why a lot of us started practicing medicine. So it's definitely, I think, a challenging time for providers just all around. That's my clinical practice. So, like, I work in the hospital, and then I do have a role in education. I'm the associate program director for the University of South Florida pediatric residency program. And I think that has really been one of those opportunities in my career and my life that has allowed me to continue to have a pulse on medical education and kind of where they're at and how they're trained in this type of care, in focusing on the patient, the bedside, and how to relate to your patients. So, yeah, that's a little bit about myself, and I'm really excited to get to our conversation.
Okay, today I want to really chat about how can providers and also, I guess, patients, how can you build trust and like emotional safety with your doctor slash your patient? Because I feel like even though they are different, like being a doctor and being a patient is different, at the end of the day, we're all people, right?
Yeah.
So I think that building trust and building emotional safety is very important. And I want to know what that looks like when it comes to you and your practice and how you educate the young minds of today.
Yeah, it's a really timely conversation because it's almost July. And for maybe some of your audience that knows, that's when all of the new interns start, is July 1st. So they're fresh, they're young, they're hungry, they're at the tail end of their training in the beginning of their practice, to where all of the medical education that they've received on one of the longitudinal courses that they do is called doctoring. And that is completely focused on exactly what you're asking about, building those relationships. Emotional safety is a really interesting term. I think it's like something that we're all seeking as people in a time where social media, right, is, I think, a lot of the times can be triggering to one side or another. Like, how do you feel safe with people when a lot of our lives are online and constantly being poked at, and we read within a lot of the times within our algorithms, right? I always think of it in that context that people are consuming their entertainment, their content, their education in totally different ways and presenting that way at the bedside and as providers, right? So I think a lot of that starts with ourselves. Firstly, I think is how do we feel about our own emotional safety and our own egos and our own worldviews? And when we take our oath to be able to really strip down any of those identities that a lot of us hold on to now, right? And say, I'm going to be here for this person, completely stripped of any of their identities. That feels naked even on our end, right? To just say, I'm in that vulnerable place to where this person might have ideas about me as a physician and as a medical system, as a practicing provider, right? Basically, someone on that side versus someone right next to me who's at that bedside. I think it starts with just having enough understanding of who you are as a person and what that might look like to say, hey, then I can understand that if there are things that may not align with my own personal values or what I feel about my colleagues and institution, to be able to then respond, I think in a emotionally safe way, you also have to feel that. And so I think for those of us in medicine, we have a long way to go there. I think in terms of understanding ourselves as individuals and individuals with our own baggage, with our own right ideas of what we think our healthcare system looks like and where patients are right now and where doctors might be right now. And I think that just unfortunately gets more narrow, maybe, I guess, as you practice, because I think you're really wide open in the beginning and you have all that just desire and fire. And a lot of the reasons why I continue working with the trainees in that way is that they do inspire me to keep back in that mindset of just, hey, this is what we worked for and this is what we've really wanted is to provide this compassionate care to patients and to improve their lives. They keep all of that very fresh. And then unfortunately, as things roll with any job, to be honest, right? You can get fatigued. You can see that it's not all rainbows and butterflies, but what we provide is is a direct impact, right, to someone's life in that way. In many ways, it's just being able to stay humble in that idea that like what you say and what you do matters so much more than you could even imagine, even if it is for the 5-10 minute encounter, right? Yeah, I think it starts with us. I think open dialogue is one of the biggest things, and being able to really understand the why of someone is really important in their questioning and everything.
Yeah, I know that you're 11 years in, right? So doctors get so burnt out, and I don't blame you. My doctor talked to me about what his schedule looked like, and he was
Yeah.
showing it to me one day. And you're literally booked from the moment you walk in until lunch, and then you get 30 minutes for lunch, and then you got to go back out there. When you are exhausted and you show up to a room and, the patient is the last patient of the day, how can you, I don't know, I guess rejuvenate yourself to be part of that conversation? I feel like that is where the emotions get blurred, right? Is that now you're tired,
Right.
you're ready to end your day, but this patient has waited all day to see you. How can, I don't know, how do you find balance there?
No, it's a great question because I think the hours alone and the level of just exhaustion and fatigue and medical training, it's one of those where if you think about it in residency, and it's changed a lot, actually. We have now work hour limitations, but there's still 80-hour work weeks, right? In medical training. And a lot of the times, unfortunately, it is violated and people work even more than that. And even when you're done with your training, I think a lot of those effects, if it makes sense, still continue on, right? We're recovering from all of the years of being just physically burnt out. And then you're catching up to a life of still really poor hours in comparison to many different practices and things, depending on what you get into. But I think that the fatigue comes with not only the physical limitations of your time. Hey, I only have 15 minutes with this patient, the time constraints, but the burnout and emotional exhaustion honestly comes with the fact that I didn't get to do what I wanted with that patient. If that makes sense, I would have loved to spend more than 15 minutes. I would have loved to I don't think I got to the root cause of this issue. That weighs on a lot of providers and physicians to be able to say that now I'm just going to have to bring them not only back, but now I'm perseverating about maybe something that didn't happen. And then, of course, we can always follow up and I give the phone call. But if you think about it in that way, that adds to our day, right? That adds to after hours, that adds to that physical time constraint. And so the system's really not set up well for us to get to really the root causes of a lot of our patients' needs. And because you guys are not diagnoses, right? You're not just like a bunch of labels. Like you're a whole human being with a personal life and stresses and everything that plays a role into that interplay of how your body reacts and all of that. So holistically, I don't feel like we get to address patients. And I think that really is a huge part of the center of burnout that I'm at least interested in. And systemic changes are so hard, of course. I think that personally speaking, when we take our oath is so non-congruent with a productivity model of basically churning out patients and collecting a fee and then moving on. So a lot of that weighs in on us and we can't think about it, right? To be able to do our jobs daily, we just have to work within the system that we have while trying to advocate as much as we can for any type of changes for our patients. But I'll say, practically speaking, if I'm just done with an encounter, I don't know if you've seen The Pit or anything, one of the medical shows
Oh
that have
yeah.
been, yeah. And you'll see the physicians on there, they just really just take a deep breath if they remember to do and they collect themselves and try to get themselves in a space to be able to like, okay, here's the next patient. Versus if the adrenaline gets you through, which a lot of us are adrenaline motivated and dopamine motivated, where you are on the tail end of just that high whatever encounter, and then you move on to the next one, and then it fuels you, and then you just come home or the bathroom break or whatever it might be, and then you just exhale. And as you can probably imagine, that doesn't always work. Some days are better than others, but we rely on each other. At least in my practice, that's a lot of the reason why I do the work that I do in inpatient. I have a lot of colleagues and we rely heavily on each other to get us through these days. And I'm really blessed in that way. I have the best work family. Relying on each other, I think, is a huge part of it.
Yeah, for sure. There's so many challenges that come with being a doctor and being a medical professional. You guys are all burnt out. There's not enough of you in any capacity. So being compassionate with your care is like what you said, right? You have 15 minutes to be compassionate, and then you got to be compassionate for someone else the next 15 minutes, which is a crazy burn rate.
Yeah.
I couldn't imagine the stress it is to carry so much weight, right? Your word carries a lot of weight for these people. And you diagnose and write prescriptions, and you get only this itty bitty amount of time with them. So I could definitely understand how it's so hard to show up when that is the model that you're given. It is also one of those things for patients that you also have to understand where these medical professionals are coming from. Yes, we are whole people, but they also are whole people with whole families. And my doctor and I have a really good relationship. And he actually messaged me one time, it was probably a year ago. And he just said, "Hey, how are you doing today?" And I was like, "I'm good." And he was like, I had a really rough day and I just needed to
Oh,
hear it from somebody that I know is one of my patients that is actually not having a rough day. And
oh,
it encourages me that like what I'm doing is working, even though I had a really rough day today. And it really stuck with me. And I don't even think he probably doesn't even remember this encounter. But I was
yeah,
just like, that puts into perspective for me that he is also a whole person with his own feelings. And that
yeah,
it has to be freaking hard to have
yeah,
patients that don't make it, right? Or progress in their disease or need to be referred out because you've done all you can do.
right.
So I think compassion in healthcare, I think, goes both ways, right?
Yeah,
I have to be compassionate because I know that my doctor is trying his best, even though some doctors aren't always trying their best.
right.
There's a caveat
Absolutely.
there. And then you guys also have to be compassionate, but also understand that sometimes there's a whole person that has been waiting for months for this very small window of an
Oh,
appointment.
absolutely. Yeah.
There's
And
challenges all over.
there's challenges all over, but something that I loved about that encounter with your physician that highlights maybe at least a small solution to some of this is that your doc in that moment was showing you his vulnerability, right?
Yeah.
And that's something that collectively we're not very good at. And it's not really taught because if you think about it, vulnerability puts you in a little bit of a power dynamic, which is not something that we should be. I mean, we understand this now, but medicine has been really patriarchal in that way, where we've always had this power dynamic, right? You are the patient, I am the healer, right? That type of dynamic. And rightfully, I think being able to kind of balance that dynamic, right? To where we are partners, right? No longer a patriarchal kind of, hey, I am the all healer, knower. This is obviously everyone, but this is historically how we've seen medicine. I think there are reasons for that. I think mainly the reason is if we were constantly vulnerable and exposed, I don't know if a lot of us would be able to move on and do the work that we do because it really can be exhausting. The difference between compassion in healthcare and empathy in healthcare is that compassion is I want to alleviate your suffering, right? I want to every day I show up as somebody who wants to be in the corner of my patients and alleviate their suffering, to hear them, to see them. Empathy is very much related, but it's a step further. It's I feel your pain. Like I physically feel your pain. And to do that all day is on another toll. To then be able to have enough in my tank to then give back just the knowledge that you need, right? You're asking me about therapies, and I need to be there and not in my feelings about what you're feeling, if that makes sense. We know that. We are motivated by that. Hey, she is suffering. But now I have to switch my brain to be able to answer the questions that you have that are very much going to impact your healthcare. So it's that constant kind of code switching, if that makes sense, from being an empathetic person with feelings and all of that, and then putting on my brain, that's my doctor hat, that is very much like giving you the evidence you need to together make a good decision for. And so that moment, your doctor, you probably see him all the time in that doctor mode, right? Hey, Jerry, let's do this, let's do that. And what do you think about this? And this is the evidence based on this. And then in a moment of, man, maybe I lost a patient or I had a tough day, also being human. So both of those things I think are very important in the longevity of what we do.
Yeah. And both can exist, right? Like they're not separated. You can be both a human and a doctor and have feelings, but also be able to compartmentalize some of that stuff in order to do your job. And that's not just being a doctor, that's life in general. You have
Yeah.
to be able to compartmentalize some stuff. And my episode next week is on mental health. And that's something that like I get a lot of questions about. It's like, hey, how do you live your life and go out and do all these things, but you're struggling with this disease? And for me, most of the time, my best friend is a therapist and would tell me that it's not very healthy, but I am like a great compartmentalizer. When I put it in the box, it's gone. Like we don't see that box again.
Yeah.
When the box explodes and it overflows, then usually that's when I address it. But I am a compartmentalizer. And to an extent, that is a healthy coping mechanism to be able to say, this cannot be something that I'm looking at all the time and like contemplating. And the same thing as a doctor, right? Like you guys, that's just a fact of the matter is that you will have patients that you lose. You will have patients that aren't doing well. And to be able to put that away and say, okay, that's one case out of the 20 cases that I'm seeing today. I have to be there and be present for all those other things, right?
Absolutely. And I definitely, in my own kind of like mental health journey, have realized the limitations of the compartmentalizing, right? Okay, it's not always that great, but it's like an unspoken almost necessity for doing what we do, again, for the longevity, because I think with maybe your audience is aware of this, but physician depression and suicide rates are unreal in comparison to other professions. And every year, hundreds and hundreds of physicians commit suicide. And I think the last that I'd seen, the female physician rate was like 400% of what it is of other professions, females in other professions. It's incredibly high and so alarming, and something that we still don't talk about very much because of, I think, all of the things that we're talking about today, right? And women, I think in general, hold on to so much of that natural empathy that we have in every aspect of our lives, where I have a hard day at work, right? And then I come home and I have to compartmentalize for my kids, right? They don't need the mom that shows up burnt out from that day, right? They need the mom that's going to show up and still have the ability to not only handle their emotions, but now be able to walk them through life, understanding what emotional regulation is. So if you can see how that day sequences, right, to where you're going from maybe a wife in the morning, trying to get things ready for your family, put something in the Instant Pot real quick, go to work, do your job, do it with, and naturally as an introvert, it's a lot of stimulation, right, at work as well. And let's say you don't have a good outcome that day for your patient, you hang that over. God forbid we make medical mistakes, right? We go through all of that. And to come home there is no decompression a lot of the times. And so you constantly give. And then I think a lot of women relate to this. When do you have time to fill your cup? And we need to be so mindful of that. So then we show up not only for ourselves, but for the people in our lives that we care about the most. And yeah, so I think that compartmentalizing has a balance, a very fine balance, to where I personally, I can share, I've added in like just a block of refill time during the week, right? Where I don't answer emails, I don't answer really anything. It's just whatever I want to work on, or I say work on, whatever I want to freely do and let go of the shame of having free time. I've added that to my calendar for the week, and it's been wonderful. And I can't say that a lot of my colleagues maybe do the same practice. Not to say it's going to work for everybody, but just to have something scheduled to where you're like, okay, how did my week go? Even reflection time, rather than cramming it in maybe to a session that's demanded at the end of the day every day. It's just you have a couple hours to yourself for free thought and free flow and processing.
Yeah, for sure. I think that's great advice, actually. And something I do with my advocacy is you're hearing this in July, but we're recording this at the end of June. So I just took 3, almost 4 weeks off because that is something that gets really draining. And we as advocates want to beat the horn and say, all of these doctors are not listening to us. But at the end of the day, I think that takes self reflection too, right? And to look at it and be like, okay, maybe not everybody is out to get you. There are definitely doctors who are human, who have families, who go home and they're burnt out, and maybe they didn't address you the way that they should have, but you also have to take into consideration they are trying. And so taking breaks and stuff for my own advocacy helps me reflect, right? And this conversation helps me reflect on the way I speak to my doctors and the way they speak to me, because it helps me be on the same playing field as them and remember that there's a lot that happens outside of that doctor's office that I don't get to see and that they also don't get to see. The post I think that I posted today was like, some people ruin it for everybody.
Oh,
And
it's
it's so
so true.
true. It's
It's so
so true.
true. Honestly, it's so frustrating to know, but you now have a group of people that you adore, right? And that you work with, that you trust. And that journey was long for you and like complicated and convoluted and almost cost your life, your resources. These are real implications. And yet you sticking and adhering to the hope and belief that there are people out there, right, that will be on your team is what got you to where you are. And you're continuing that for your audience. And that's so important. And sharing those stories, sometimes on our end, it's intimidating, right? Because we don't want to be painted in a way that is you just come off and stressing. However, still an important conversation to have, because again, I shared with you prior to us like recording this, right? Like I've had my own personal struggles with the healthcare system being a physician, right? Where there were misdiagnoses, and oftentimes, even though I might be quicker to understand why that happens, it doesn't take away the fact that it does happen, and that we have to hold ourselves to a higher standard, period. Like I feel that way across the board. We are human, and we take what we have done maybe not well, but we use it to learn. And as long as we're able to do that, hopefully in collaboration with our patients who feel strong enough and confident enough to ask for what they need, right? Because maybe we're not scanning it right properly because our mind is in a million different places. But if we have a family, kids, of course, can't advocate for themselves. That's my audience. Their parents are their representatives. They're their advocates. And sometimes just understanding where they're coming from is enough to heal so much that we can come together and actually have the best outcome possible with taking our guard down in that regard. I understand all those aspects together, and I hope that me and my personal journey of returning back to that compassion has been a part of my journey out of burnout when it was at the peak, probably during COVID for a lot of physicians, and where I think a huge divide happened between trust, right, in patients and their providers. But coming out of that and reclaiming it as a part of my own practice and advocacy like this, it's been really rewarding. And it does remind me that we're all people having literally human experiences together. And yes, by profession, by training is the path that I wanted to lead. And yet, how do we do it again, sitting on the bed together versus standing over my patient? That's the visual that I have now going
Yeah.
into
Yeah. Yeah.
patient rooms. It's like just getting on eye level, really seeing people for who they are. And I don't do it perfectly. Every day is different. Just every day committing to that and saying that this is my intention, I think can help a lot of us who are on this side of burnout and moving through the process and like finding love in something that was so sacred and wonderful for us when we started. So yeah, I hope that more of my colleagues too can hear some of this and be able to take that with them. And I know that it's so difficult and so hard because that flame sometimes is just almost completely out at this moment. I think at this juncture in our healthcare system and journey, but it's so important. And I hope that patients also still feel confident through work that you're doing to be able to know how to advocate for themselves and get a respectful response and collaboration and teamwork. That's the goal for sure.
Yeah. I feel like some people that were tuning into this podcast expected me to sit here and ask you, how can doctors be more compassionate? But I also am glad that the conversation is the way it is because I did want everybody to understand that I am not out to yell at a doctor and tell a doctor that you're not doing it right. Yes, we do hold you guys to a higher standard. You had lots of
Absolutely.
schooling, you're in the field, right? This is what you chose. But at the end of the day, I hope that what everybody gets from hearing this specific podcast is that everybody here is a person. And it's just like in church. It's just like when you go to your own jobs and like when you go to your kids' schools. Some people you jive with and some people you don't. And sometimes somebody's what method of communicating is not the best method, but that
Mhm.
doesn't mean that there's not somebody out there that could communicate with you in a way that you would feel safe. And being compassionate doesn't mean just being nice. It means that you're out there and you're being vulnerable and you're showing a little humility and that you're meeting people where they are and not expecting them to be at a certain place when you get into the room. And that's both sides of the table, right? Meeting somebody in the space as a patient, knowing that this person probably is exhausted. If you're seeing them at the end of the day, it's a long day, it's been a long week. And if it's a long day for you, it's just as long of a day for them. So there's compassion on both sides of the table. And I'm really glad that we got to have this conversation because I do think that in order to listen and collaborate, you have to both be willing to listen and both be willing to collaborate and understand that nobody is perfect and nobody's going to be perfect in any space that you go into. Everybody is just figuring it out. And I am so thankful that I do have a team and doctors that I work with that I do trust and that I will send my fellow patients to but everybody is burnt out in some capacity. So I want to make sure that when we're talking about compassion in healthcare, that we're not just talking about just the doctors that have work to do. It is also patients and advocates that get out there and only preach the bad stuff. And you're like, you could also say some nice things here and
Yeah.
there. And people are always like coming at me because I'm a silver linings person. But that is actually who I am. That's who I am to my
Yeah.
core.
Yeah.
And I don't think anything's wrong with that. I also
Right.
do think that it gives a double perspective, right? There are people who are constantly negative, and you'll find doctors that are like that too.
Oh,
And then
for sure.
there
Mhm.
are people who aren't like that. And so if that's not your person, that's just not your person. And that's okay to ask for a new doctor or to find a new doctor. But is also to understand that you guys are human, you're struggling just like everyone else. And you're still, even after 11 years, sometimes it still takes time to get footing in your own practice and education and educating the new people on how to do it a little better than you did.
Yeah.
And I think that takes humility too at the end of the day, is to say, maybe I didn't do it right those
Oh,
first
yeah.
10 years.
Absolutely.
So thanks for joining me today. If you had one last parting piece of advice, what would you say to everybody listening?
Oh boy, I'm a Capricorn, so I always give advice unsolicited. That's my unfortunate downfall in life, if we had to say. But if I had to say about our conversation about compassion in particular, I think it's just important, and we've highlighted this before. We all have our own value systems, our own moral compass, our own experiences, and we're all complex human beings with just a perspective of trying to be heard and seen. And I think that exists on whatever space, no matter what podcast you want to translate that message to. But I think it definitely is needed right now more than ever. Open dialogue and understanding that exact thing is that we're all unique people coming together. And I would hope that for your audience who, maybe struggling right now, trying to find that fit, as you mentioned, to just keep going, keep advocating for yourselves and understand, yes, that we are people and that sometimes being able to see us as that will actually work to your advantage and being able to come up with the best relationship that you possibly can, right? It's with any other relationship is it's a give and take. It's a compromise. It's a coming together of being able to work together for a lasting relationship. And this is not just with disagreements. This might be with just your view on how you want your own healthcare to look like versus their view, right? And being able to see who's willing to work together like that and just keep trying and understand that I do feel like we are having more counter effects to burnout professionally in education and beyond, like social media awareness in medical education. So I do hope, and I'm a glass half full person and positive person, I hope that the landscape of medicine can swing back to the center of coming out of this haze of burnout. That's my own hope in the next 10, 20, whatever years it takes. But I do see us reclaiming our own exhaustion. So I hope that just trickles down to patients and that we can come together and work as teams as we should have been this whole time.
Thank you, Dr. Shirag, for coming and hanging out with us. If you're listening to this and you liked this episode, please like it, comment, subscribe. We will be chatting at a different time, talking about medical gaslighting. That'll be a whole different conversation. But I'm so thankful that you guys are here. I'm thankful that you guys are listening, and tune in next week for another episode. Bye.